Dr. Irazola is the Director of the Department of Research in Chronic Disease at the Institute for Clinical Effectiveness and Health Policy. It's an academic institution affiliated with the University of Buenos Aires, Argentina. She's the Director of the Center of Excellence in Cancer Research and Senior Researcher at the National Scientific and Technical Research Council of Argentina. Over the last 25 years, Dr. Irazola has led epidemiological and intervention studies aimed at health promotion and chronic disease prevention and management in Argentina, Latin America, and globally. Her research is focused on implementation science and health systems in chronic disease and aging. Dr. Irazola has led numerous implementation science projects in the field of integrated healthcare in primary care and community settings. Please welcome Dr. Irazola.
Good morning, everyone. Thank you, Maria, for your kind invitation to participate in this event. And the idea over this first talk is to share some knowledge and comments about TMF, about theories, models, and frameworks that we use in implementation science. So some key messages that I'd like to share with all of you are related to the concept of complexity. In implementation science, we always work with complexity. This is part and parcel of implementation science. I know that all of us know that. And because of that, implementation science relies on theories, models, and frameworks that we will go through today. Also, I'd like to highlight what we call the three main pillars of implementation science, which are context, a deep knowledge of the context where we work, the involvement and engagement of stakeholders, and the co-design of implementation strategies for different given contexts. So what is implementation science and why is it so important? Our colleagues have highlighted the importance of bridging this gap between what we know and what we do in practice. So the main principle underlying implementation science is bridging this gap between knowledge and research and what we do in practices and policies. So all of us know that this is very complex. And as I said before, complexity is really part and parcel of implementation science. And that's because we always deal with complex problems that have, thank you, problems that have different causes, pathways, factors that interact among each other. So we always deal with complex problems. And also we work in complex contexts at different levels, leading with different stakeholders. The context in which we work is also changing over time, and we have to be very much aware of that. And also we work with complex populations. Our colleagues have been talking about equity and diversity in implementation science, and that's part of the complexity of the populations with which we work. So to address these complexities, we also we design interventions that are complex. And how we define complex intervention, we say that a complex intervention is an intervention that is made of different components, more than one component, and that's typical of implementation science. And this is different for traditional research, where, for example, let's think of a clinical trial to test the efficacy of some medication to treat hypertension, for example. The only component of the intervention is the drug, the medication we are testing. But in implementation science, and because all this complexity we have to embrace, our interventions are complex and are made by different components, usually at different levels, the individual, the community, the health system, or even the macro level, and usually as well with these complex interventions, we approach different behaviors. So implementation strategies, of course, are also complex. And because we work in this complexity environment, implementation science relies on theories, models, and frameworks. We need these tools to deal with this complexity. And there are three main things that we need always in implementation science, whatever the project is. The first is how to understand and leverage mechanisms of change, how to design interventions that allows us to achieve the desired changes that we are looking for. So we need to understand those complex mechanisms of change, and to do that, we use theories of change. So we always need a theory of change through which we can understand the different factors that we have to approach to achieve the desired changes. And because there are many things that we have to do in these complex projects, we need a guide. We need a map to guide us in the process of not only designing interventions and implementation strategies, but also conducting those interventions in the field. And to do that, we use process models. So process models are those tools that we use to set the steps, to organize our work, and set the steps that we should follow, what we have to do, when, how, where, who, all those aspects of the implementation projects are part of these process models. And finally, of course, we have to evaluate what happened and how it happened. So we need process and outcome indicators always. And because we have to measure many things and many aspects of these complex problems, we need evaluation frameworks. So we can see here in this slide a summary of the three main functions that we always need to work with in implementation science, and the tools that we use to help us achieve our goals. So let me just share a few examples of theories, models, and frameworks. There are a lot of them. We call them generic theories, models, and frameworks because in general, they are applicable to many different projects. Let me mention one example, at least, of a theory of change. Here we have the COM-B theory. According to this theory, to change a given behavior, we need capabilities, opportunities, and motivation. So in terms of capability, we are talking about training, capacity building, building capacities in the organizations and in the community. Those are examples of this dimension of the theory. We also need opportunity. And when we talk about opportunities, we refer to the environment, both the physical environment, for example, green spaces or measures that we can take at the urban level, for example, to improve walkability or promote physical activity to make it easier for people, or the food environment, but also the social environment. So we are talking about communication campaigns and social groups and the civil society. In terms of motivation, we can include here both intrinsic and extrinsic motivation. Examples of intrinsic motivation can be tools to improve, to empower patients, for example, with different conditions to take a lead on their self-care. When we talk about extrinsic motivations, we are talking about incentives, both financial and non-financial incentives and so forth. So let's see what example now of a process model. And we have here the EPIS model. There are a lot of process models that we can choose from. This is one of them. It's called EPIS, and EPIS proposes 4 different stages for our work, which are exploration, preparation, implementation, and sustainment. And in each of these steps, we have, of course, several subdomains to consider. And as we can see in this figure, all these steps consider the outer and the more inner organizational setting as well. Another example is CIFER. CIFER is a framework very much frequently used in implementation science. It's a consolidated framework for implementation research. And as you can see here, using CIFER, we can have a deep exploration of the context where we are working, but also we have a process model with different steps. In this case, planning, engaging, executing, reflecting, and evaluating. So this is another example of a process model embedded within this broader framework. And finally, an example of an evaluation framework. So, for example, we can talk about REAIM, again, very much frequently used in implementation science. Again, there are a lot of evaluation frameworks. This is just one of them. And according to REAIM, we should evaluate reach, meaning how I reach the target population. Of course, what is the effectiveness of the intervention, the degree of adoption of the intervention we propose by the implementers, implementation fidelity versus adaptations that always are needed in the field, and maintenance and sustainability of those interventions. So these are examples of generic theories, models, and frameworks that we always need for an implementation project. But sometimes we need to complement this generic TMF with some conceptual additional frameworks depending on the type of intervention we are working with. For example, if the intervention or one component of the intervention is a digital intervention related to mHealth, for example, we will need to complement these frameworks with specific frameworks related to digital intervention. This is one example. The ACTS, which developed by David Moore, which ACTS stands for activating or accelerating changes to sustainment. If equity and disparities and diversity is a specific focus of our work, we also have different specific frameworks that can complement those who I just mentioned. If we are very much focused on a gender perspective, also we have several specific frameworks to better and more deeply approach gender. If we are talking about multi-level interventions, the social ecological model is very useful. If we are working with a multi-sectoral approach, the framework proposed by WHO back in 2021 is very useful. If we are not talking about creating interventions, but adapting a proven effective intervention, we have also frameworks that help us a better process for that adaptation. And if we are talking about policies, we also have frameworks that are more focused on policies as well. But finally, the common aspect of all these theories, models, and frameworks that I'm mentioning today are these three key pillars in implementation science, which are a meaningful stakeholder engagement and involvement, a deep understanding of the context, and the co-design and testing of implementation strategies. Thank you very much for your attention.